Hi, this will be the first of your lectures on disturbances in perception and coordination. So specifically in this unit, we will be talking about your neurologic disorders, among the most interesting topics in medical surgical nursing. Now, for us to understand what are the problems that we will be dealing through in this unit, you need to understand the definition of perception and coordination. When I say perception, this refers to the memory and interpretation of new sensory data. So this makes use of your memory and the interpretation of new sensory data in terms of previously encountered information. So basically, it is how you perceive the current data, new sensory data, which could come from your five senses based on the information that you have previously encountered. So that's your perception. When I say coordination, this talks about the combination of nervous impulses in motor centers that would ensure cooperation of appropriate muscles in a reaction. So the key word there is cooperation of appropriate muscles. When you say that there is coordination, the neural impulses and then the muscles would coordinate with one another. Meaning, if the brain thinks that you need to move, you are expected to move and you're expected to do it with balance, or else coordination is affected or coordination is impaired. So what are the systems involved in your perception and coordination? So you have your nervous system, the system that our focus for this discussion. Then you have your eyes and your ears, or basically your five sensory organs. And then you also have your musculoskeletal system. Okay, so these three counteract with one another, help with one another in order for perception and coordination to be done. Okay, or perception and coordination to be in equilibrium. Any problem on the nervous system, ears, eyes, or musculoskeletal system would result to an impairment on your perception and coordination. Okay, nervous system, will be discussing them in detail. For example, your ears. Your ears will be concerned about your balance and equilibrium. Your musculoskeletal system will be concerned about your movement. So any problem with these three, okay, would lead to a problem on perception and coordination. Now, the disturbances on your perception and coordination may be on any of these three levels. One, it could be on the reception of sensory data. For example, there may be a problem on how your eyes or how the structure of your eyes receive the signal from the outside environment. Second, transmission of data. When I say transmission of data, there may be a problem on the transmission of the signals from that of your eyes going towards the occipital lobe of your brain. In other words, there may be a problem in your occipital nerve, okay, or your optic nerve, I mean. Then third, interpretation of the incoming stimuli. So the interpretation is usually taken care of by our brain and sometimes your spinal cord. So if there is any compression, any problem, lack of oxygenation, or any struggle in the brain structure or its physiology, it will affect the way the data is interpreted. So come to look at it. It's from the source, the way the data is transmitted, and the way the data is interpreted that could lead to your problems in perception and coordination. Then, let's talk about your nervous system. So when I talk about your nervous system, these are composed of highly specialized cells, okay, your neurons, which gives us the ability to think. Okay, it has the ability to regulate and integrate all of our body functions. For example, you have your hypothalamus that would regulate the release of a lot of hormones. These also regulate our mental abilities and our emotions. Okay, the seat of your emotions can be found in your brain. So basically, it is responsible also for the maintenance and control of itself, as well as the control of the rest of the body. So your nervous system is composed of three basic parts. You have your neurons, you have your brain, and then your spinal cord. Now, let's talk about the anatomy and physiology of your nervous system. Now, the nervous system is divided into two. You have your central nervous system and then your peripheral nervous system. When I talk about the central nervous system, I just would like to remind you, this is composed of your brain and your spinal cord. And then your peripheral nervous system is composed of your cranial nerves, your spinal nerves, and then of course your autonomic nervous system. Okay? Now, try to ask yourselves, how many cranial nerves can you recall? How many spinal nerves are there? And what do I mean by autonomic nervous system? Now, neuron. We said that the basic functional unit of the brain is your neuron. If your kidney would have nephrons, if your lungs would have alveoli, if your liver would have hepatocytes, our brain would have neurons. Okay, so your neurons is the basic functional unit of the brain. So, it is composed of the following parts. You have your dendrite, you have your cell body, and then your axon. So your dendrite acts as the receiver end of your neuron. It is the one that receives signal from another neuron. So it has a branch type structure that receives electrochemical messages. Your cell body, on the other hand, also referred to as soma, okay, would occur in clusters. So when I talk about cell body occurring in clusters, another term for this is ganglia or nuclei. Okay, so when I say, or when you hear the term ganglion and nucleus, you need to recheck the sentences or the structure of the statement, because this may not be referring to the nucleus that you're thinking of as the main part of your cell. Okay, when I say ganglion or nucleus, this may refer to group or clusters of cell body clumped together. Okay, then axons. Your axons are long projections that would carry your chemical impulses away from the cell body. So it would pass through the dendrite, then the soma, and then the axon. So it is the axon that would carry the signal away from the cell body going towards another neuron. And that would be through the dendrite of another neuron. Okay, so let's look at the structure of your neurons. Okay, looking at the structure of this neuron class, you will see that these are the dendrites. Okay, these are the dendrites. These are the ones that would receive the signal from another neuron. And then you would notice that this is the cell body or the soma that we're referring to, and then clusters of which will be referred to as ganglia or nuclei. And then you have your axons, which would be referred to as your sender. Now, two particular parts that I would want you to focus on in this diagram or picture is the myelin sheath and then the nodes of reindeer. Now, for your myelin sheath class, this refers to a white lipid substance which increases the speed of your nerve impulse conduction in axons. Okay, so you have your white lipid substance which increases the speed of nerve impulse conduction in axons. Again, the purpose of your myelin sheath is to increase the speed of nerve impulse conduction. Meaning, if your myelin sheath would be disrupted, okay, or disrupted in function, the transmission of signal would be decreased in between this, in line of the axons. Again, if the myelin sheath is damaged, the transmission of signal or electrical impulse is slowed down in this axon. Okay, try to remember that. There are disorders which would have that problem. And then you have your nodes of reindeer. If you can notice, why are there spaces there? Okay, so those are your nodes of reindeer. So what is the purpose of these nodes? These nodes are unmyelinated areas, meaning they are not covered by myelin. They allow movement of ions between the axon and the ECF. Again, they would allow movement of ions between the axon and the ECF. So try to remember your friend's myelin sheath and nodes of reindeer. Next, we have the term afferent neurons and then your efferent neurons. So class, when I say afferent neurons, you should already remember that these are sensory neurons. Okay, meaning they are the ones that would bring the signal to the central nervous system. So your efferent neurons, on the other hand, are motor neurons. They are the ones who give us the effect. Okay, in other words, they are the ones who carry the signal from the CNS to action site. Okay, so what do you mean by that? For example, if your skin, okay, would feel that there is, let's say for example, there's hot temperature felt from your skin would transmit the signal to your afferent nerve, okay, going towards your spinal cord. Then your spinal cord will give a signal to your efferent nerve that, oops, that's hot, you need to remove your hands. Okay, so and it will be the muscles which will be doing the movement. Okay, take note, class, that these neurons could be up to the brain or it could be up to the spinal cord. If it is only up to the spinal cord, that is how your reflex arc would work. Okay, that is how your reflex arc would work. What do I mean by reflex arc? For example, if you touch a hot stove, class, the tendency is that before you even felt the pain perception or before you even felt pain, you will remove your hand. Okay, that is part of your reflex arc. These are signals that are not yet reaching your brain, however, it triggers for you to do some responses. So that's why, class, look at the definition. It does not say that the afferent and deferent neurons will be from or to the brain alone, but it is from and to the CNS, okay, or the central nervous system, which could either be your brain or your spinal cord for that matter. Now, let's talk about your neurotransmitters. I know you've met your neurotransmitters in your psychiatric nursing, so this is just a recap. Okay, so class, the purpose of your neurotransmitters is to communicate messages. These messages could be either from neuron to neuron or from a neuron to a target cell. Okay, the target cell could be that of a muscle, it could be that of a gland, it could be that any organ in the body. Okay, the target cell, anyway, your neurotransmitters are manufactured and stored in the synaptic vesicles. Okay, again, they are manufactured and stored in the synaptic vesicles, the one that we commonly refer to as your synapses. Then, your neurotransmitters could be classified as either inhibitory or excitatory. So when I say inhibitory, these are neurotransmitters that would decrease the likelihood that the neuron will fire an action potential. When I talk about excitatory, they would increase the likelihood that the neuron will fire an action potential. Okay, again, inhibitory would decrease the likelihood of firing an action potential. Excitatory would increase the likelihood of firing an action potential. Okay, so class, the inhibitory and the excitatory neurotransmitters would work the same as your endocrine hormones. Okay, they work with your negative feedback mechanism. And if you can recall our discussion in endocrine system, when it comes to the physiology of the endocrine system, whenever there is an increase in the neurotransmitters, okay, you have your hormones that would compensate, that would balance, or that would make counter-regulatory measures for these neurotransmitters effects to be balanced out. Okay, so again, negative feedback mechanism is on the work. Now, there are different neurotransmitters. Okay, so introducing to you, you have your adrenaline, okay, you have your noradrenaline, dopamine, serotonin, you might have met your GABA already, then you have your acetylcholine, glutamate, and then endorphins. So allow me to focus on some of the functions related to neurosystem. Okay, now for the neurotransmitters, okay, let's try to talk about acetylcholine. If you have recalled your lessons in sympathetic versus parasympathetic nervous system class, your acetylcholine is considered to be the major neurotransmitter of your parasympathetic nervous system. Okay, it's the major neurotransmitter of your parasympathetic nervous system. And if you can recall the function of your parasympathetic nervous system class, okay, it would usually decrease our heart rate. It would also decrease your blood pressure. It would also result to a decrease of some of your functioning related to fight or flight response. Now, your acetylcholine class would also act on muscles. Okay? Class, it is your acetylcholine that would cause the contractions of your smooth muscles. So, other than the parasympathetic nervous system effects, your acetylcholine would also cause contraction of your smooth muscles. For this reason, class, your acetylcholine is considered to be excitatory and inhibitory. Excitatory in such a way that it causes contraction of your smooth muscles, inhibitory in such a way that if I talk about parasympa, it talks about vagal stimulation, it talks about dilation of your blood vessels, decrease of your heart rate, decrease of your blood pressure. Hence, you have inhibitory effect. Now, norepinephrine. Your norepinephrine is considered to be excitatory. Now, your norepinephrine is considered to be the major neurotransmitter of your sympathetic nervous system. Recall that your sympathetic nervous system will be your fight or flight response. Add on to that, okay? Oh, by the way, recall first that your sympa would increase your heart rate, increase your blood pressure, causes vasoconstriction. Other than that, class, it also affects our mood and overall activity. Okay, so mood is affected by your norepinephrine. Now, you have your serotonin. So, class, your serotonin is considered to be an inhibitory neurotransmitter. Your serotonin is able to control your mood and sleep. Okay, if you can recall in your discussions in psychiatry, usually patients with depression would have problems with serotonin. So for that reason, we give your medications such as your selective serotonin reuptake inhibitor. In terms of medical surgical functioning, class, remember that your serotonin would inhibit the pain pathways of your patient. So class, the tendency is that if there is increased serotonin levels, your patient is less likely to experience pain, and or the pain perception is decreased. Then you have your dopamine. So class, your dopamine is considered also to be inhibitory. Your dopamine, class, would affect the behavior, including the attention, okay, the emotion, and then the fine movements of your patient. Okay, again, it affects behavior, such as attention-related and emotions. Then class, fine movement. Recalling, class, your lessons in pharmacology, you might have been reminded that your dopamine is the one that is lacking on a patient with Parkinson's disease. Okay? Recall that a patient with Parkinson's disease is characterized by your BRAT, and the letter T there is your tremors. So class, whenever there is deficiency of dopamine, you will have problems in fine motor movement. So these patients are unable to write effectively because they're having tremors because of the lack of dopamine. For that reason, among your patients experiencing the lack of dopamine, we give your dopaminergic medications. Okay? Recall also your lessons in psychiatry wherein your patients who are taking antipsychotic medications or antidepressants may also be experiencing pseudo-Parkinsonism. Okay, class, remember that the pseudo-Parkinsonism is caused by the inhibition of your D2, okay, a specific component of your dopamine. If you can recall in your psychiatry, there are D1 to D5, okay, which are dopamine subtypes. Particularly, if D2 class functioning is being inhibited or stopped, that would result to signs and symptoms related to your pseudo-Parkinsonism. Okay, for that reason, you might have noticed that your atypical antipsychotics would have minimal side effects compared to your typical antipsychotics, because your atypical antipsychotics does not directly attack on the D2. It does not decrease the levels of your D2 abruptly. So for that reason, it would have minimal side effects compared to your typical antipsychotics. So we already had 4 neurotransmitters. So one was your acetylcholine, which is both inhibitory and excitatory. You have your norepinephrine, which is considered inhibitory. You have your serotonin, inhibitory. You have your dopamine, inhibitory. Then, let's have your GABA. Okay, gamma aminobutyric acid. So your GABA is also considered to be inhibitory. Its main role is to receive the communication between the brain cells. Okay, so gamma amine butyric acid. Okay, so class, inhibitory for that matter. Then, I think you're not familiar much with enkephalin, but your endorphins. Okay, you know that your endorphins are your happy hormones. So class, your endorphins and your enkephalin would is considered to be excitatory and are in charge of the pleasurable sensation, and it would also inhibit your pain transmission. Okay, so those are the 6 neurotransmitters with specific neurologic functions. I hope that you will try to remember them, especially that we are discussing your diseases already. Now let's talk about your central nervous system. Okay, so let's start with your brain. Your brain is approximately 2% of the total body weight. So imagine it's 2%. If you're weighing an average adult of 60, okay, 60 kilograms, okay, you expect your brain to be somewhere at around 1.2 kilograms. Okay, as you can see, for a young adult, it averages as 1,400 grams. For an old adult, it's 1,200 grams. Your brain obviously is the control center of our nervous system and the control center of our body. Your brain is protected, since it is a delicate organ, it is protected by your skull or your cranium. Okay, so the entire structure is referred to as a skull, and your skull is composed also of several bones. Now, When I talk about your brain, it is composed of several parts. So you have your cerebrum, you have your diencephalon, you have your brainstem, and then you have your cerebellum. Okay, going down, you have your spinal cord. Now, when I say cerebrum, so that's the big part here, which is divided into several lobes. When I talk about your diencephalon is divided into your thalamus, you have your epithalamus, and then you also have your hypothalamus. Okay, congruent to that or beside the thalamus, you have your pituitary gland. Recall that your pituitary gland is a major organ also of your endocrine system because it is where the glands which would trigger the other parts of the glands or other parts of the endocrine system to release their respective hormones. Now, on your brainstem, okay, you have your midbrain, you have your pons, and then you have your medulla oblongata. Okay, your brainstem is very crucial, especially in the functioning of your respiratory system and then your cardio system. Then you have your cerebellum. So your cerebellum is talking about balance and coordination. We'll be discussing these parts one by one. So the three major areas again of your brain are your cerebrum, cerebellum, and then your brainstem. The part not mentioned here is your diencephalon. Okay, so class, kindly take note of the location of these major parts of your brain. Now, your cerebrum. So your cerebrum is referred to as the outer surface of the hemispheres. Okay, usually it would appear to have a wrinkled appearance, and that wrinkled appearance is because of your gyrus and your sulci. Okay, so it's divided into two cerebral hemispheres. You have your left and your right hemisphere. And these two hemispheres are being connected to by what you refer to as your corpus callosum. If you look at the picture in your left class, okay, this is your corpus callosum, the one highlighted in green. So it is a thick collection of your nerve fibers that would connect the two hemispheres, and they are responsible for transmitting information between the two hemispheres. Then you have your gyrus, the plural of which is gyri. So your gyri are folded layers of or convolutions of your brain. So the folds here are referred to as your gyrus, okay, or gyri, plural. Now, the anatomic divisions between this gyrus or gyri is what we refer to as your sulcus. Okay, sulcus, sulci, or fissures. Fissures are usually your major sulci. Okay, your fissures seem to be the division between your lobes. Okay, so your sulcus or sulci are the grooves, they are the divisions between your gyrus and gyri. And the major divisions are referred to as your fissures. So class, if this is your gyrus, okay, these are your sulcus. So these are your sulci. Okay, so this is a picture of your brain. Class, you can see these are the important sulci or the anatomically relevant sulci. So you can say that these are supramarginal gyrus. Okay, you have your postcentral sulcus. You also have your precentral sulcus. You have your middle frontal gyrus. Okay, just familiarize yourselves with the location of these sulci and gyrus. Okay, so class, this is the posterior part of the brain and this is the anterior part of the brain. So this will be your frontal lobe. Okay, as you can notice, the names are also related to its anatomical location. Now, the cerebrum class is divided into two parts. You also have, two portions. So you have the external or outer portion, which is rich of gray matter. So that portion is referred to as your cerebral cortex. So class, it is composed of gray matter, which contains millions of cell bodies. It is the part that processes your information. The innermost layer class is composed of your white matter. Okay, class, white matter and composed of myelinated nerve fibers. So this white matter class or the white color is in fact attributable to your myelin. So class, the white color there is because of the myelinated nerve fibers. And then you have neuroglial cells that would transform, okay, or that forms the tracks that would send the information. So the information are processed on the external or outer portion, and then it is being sent in the innermost portion, which is your white matter. The outside portion again is your gray matter, and then the innermost portion is composed of your white matter, and the white color is attributable to your myelin. So class, we have the lobes of your brain. So you have your frontal lobe, your parietal lobe, Okay, so frontal here, parietal here, you have your temporal lobe here, and then of course your occipital lobe. Each of these lobe has their own functions. Okay, so you need to familiarize yourselves with the function of the lobes. So plus the frontal lobe, it is the largest lobe in charge of concentration, abstract thought, memory, information storage, and even motor function. Okay, it is also where our affect, recall your affect, it is the outward manifestation of your mood. It is also where our judgment, our personality, and inhibitions are located. That's why class, patients who would have stroke which led to infarct or decreased oxygenation to the frontal lobe would have problems on personality changes, difficulty on concentrating, difficulty on doing planning, and they tend to be impulsive. Next, you have your parietal lobe. Your parietal lobe is considered to be a sensory lobe. It would analyze sensory information and would relay it to other lobes. It is also the one which makes the body aware of the body position in space, size, and shape discrimination. If your patient would have a problem on parietal lobe, let's say for example, there was a structural decompression of your parietal lobe, it would lead to difficulty with writing. We refer to that as agraphia. It could lead to disorders of language, such as your aphasia. And then there is a problem in ability to perceive objects normally. So you have your agnosia. Okay, so class, what do I mean by agnosia? For example, if you will be placing a coin on my hand with my closed eyes, I will not be able to recognize that that is a coin. Okay, that is agnosia. The common objects that we use for stereognosis is your key and then coin, because these ought to be familiar objects on the part of the patient. Then class, you have your temporal lobe. Okay, looking at the location of the temporal lobe, you should recall that this would act as auditory receptive areas. So that is for our ears. Okay, so it is where the memory of sound and understanding of language and music is being processed. Okay, so class, due to its close proximity to the ear, so you have the auditory receptive areas for your temporal lobe. If your temporal lobe would be damaged, class, of course you would have problems on hearing. So there will be problems on recognition of words, or there could be loss of or it could cause inhibition of talking. Okay, so your patient unable to talk because your patient is also not hearing sounds. Okay, so those are problems on your temporal lobe. Then you have your occipital lobe. Class, take note, your occipital lobe is the one which is in charge of visual interpretation and memory. Okay, so visual impairment would result if ever there are problems or stroke on the occipital lobe. So there could be blindness, if not, there could be blind spots, okay, visual distortions, or visual inattention. Okay, because again, class, your optic nerve from your eyes would go directly to your occipital lobe. Okay, so class, these are the functions of your respective lobes summarized on a picture. Okay, so class, your frontal lobe would be in charge of your association area and then speech. Okay, class, your temporal lobe, part of which is also in charge of smell and then also your hearing. Part class of your parietal lobe is in charge of speech, taste, and reading. And then part of your occipital lobe is vision. Okay, so I hope that you will try to remember those specific functions in such a way that if you know what lobe of the brain is damaged, you will know if what are the anticipated effects on the physiology of your patient. We'll continue your discussion on the succeeding lecture. Thank you for your attention.